SIZZLE on Iron Skillet Radio and Iron Skillet Television.
Welcome back to the Sizzle. On this episode, we have Dr. Darryl L. Fortson, family medicine from the region, currently practicing in Las Vegas, here today to talk to us about the effects of cardiac arrest in student and young athletes. Dr. Fortson, thank you for joining us today.
Thank you for having me, Gregory.
Dr. Fortson, can you provide some insight into why cardiac arrest has become such a concerning issue among youth athletes currently?
Well, I think all of us have been brought to an understanding that these things happen with the two events, the most recent one being with the young man, Ronnie James, son of LeBron James, who collapsed a few days ago at practice at USC while practicing with his basketball team. Also, the player in Buffalo for the Buffalo Bills, Mr. Hamlin, the secondary man who collapsed when he was struck in the chest while playing. These were very terrifying events. They were life-threatening events, and we've heard of other young people who have succumbed on the field. There was even a soccer player a few years back who collapsed and had to be resuscitated over in the European League for soccer. And so these are very frightening events when they happen to people that are so young and when they are seen on television and prominently displayed and talked about. It's a very scary situation. And so all of us are kind of brought to an understanding that these things happen. They don't happen much, but when they do happen, they're terrifying, concerning, and sometimes fatal. And so you're going to hear the media talking about these things more and more.
Dr. Fortson, how can we detect these conditions that lead to cardiac arrest in youth athletes? How do these athletes and how do these teams, how do they keep up and learn how to know when this condition or when there is a condition in their players that's occurring?
Well, Greg, this is an issue that is debated in pediatric medicine and cardiology, in cardiac medicine and in cardiology as well, because these events are so rare that it's hard to justify massive amounts of effort or money being spent to find just a few cases. But at the same time, the cases are so devastating that it's difficult to ignore. Generally speaking, the literature says that every athlete who's participating in competitive sports, team sports, or in a athletic competition needs to have a physical examination. And all of us who have played some kind of sports in high school or even in elementary school or for Little League, whatever, Pee Wee football, any of the youth leagues have had to have a sports physical. They have to have a clearance by a physician. And usually that just means a physical examination. Now, with the advent of these cases being brought, these sudden death cases or cardiac arrest cases being brought to the fore, one would be tempted to encourage everyone to have an EKG. The literature seems to show that that's not it's not recommended in the by pediatric physicians and by those who do these types of exams because of two things. One, you have a lot of cases where the EKGs will be falsely negative, that is, nothing is found, and if you do a lot of these screenings, a lot of them will be negative. Nothing will be found, but in fact there may be disease. Or also problematic is where you may have a lot of cases where people will be screened and found to have something wrong, but there's nothing going on. So, it can go both ways. You can have an exam where it's falsely positive and the person is actually well, or where the EKG is falsely negative and it's actually missing some serious disease. So you want to try to look for cases where you're most likely to get the greatest amount of yield. That is, individuals who may have a family history of sudden cardiac events, children who may have had anomalies at birth where they required heart surgery, or children who are symptomatic, those who may have been complaining of being short of breath or feeling lightheaded or feeling flutterings in their chest around the time of the exam. If you get these kinds of symptoms being displayed by the patient or being complained about, they need to be pursued to make sure that there's nothing going on that might rear its ugly head at the worst possible time.
Dr. Fortson, even though there are early screenings and early detections in some cases, especially with cardiac testing, is this an evaluation that has to be done by a physician, or is this someone who can be done by a sports medicine specialist? Who should be the recommended person that athletes and parents are going to make sure that they are going through the correct battery of testing for such in case of a cardiac event or an arrest in this manner?
Well, you want to do screenings, and with screenings, you can do those broadly with physicians, MDs, DOs, and even with physician extenders such as nurse practitioners or physician assistants. So it basically involves taking a good history, listening to the heart, listening to any murmurs or any extra sounds, listening to the lungs, make sure that they're clear, not seeing any signs of swelling in the extremities or anything else that might indicate that there's a deficit in how the heart is working. And any licensed provider at the level of physician or physician extender should be able to get a good history and physical exam and screen for those things. If you hear any history or any physical findings that are concerning, then it would be a good time to refer those patients to a pediatric cardiologist to get an EKG and to do a more in-depth examination. That might even include an echocardiogram, which is basically an ultrasound of the heart. It might even include a stress test, but usually an EKG and an echocardiogram will tell you most of what you need to know about what's going on with a young person's heart.
Dr. Fortson, for our listeners, for the parents and for the athletes who are listening to us, when you talk about cardiac arrest, what is the definition of cardiac arrest? And is it the same thing as a heart attack, or are they different things altogether?
Well, there are a lot of similarities between the term cardiac arrest and heart attack. Heart attack would be considered more of a subset of cardiac arrest. That is, a heart attack can lead to a cardiac arrest, but that doesn't mean that all cardiac arrests are due to heart attack. A lot of times when we think about a heart attack, most of the time when we think about a heart attack, we're thinking about an occlusive event in the vessels of the heart. That is, the heart is not getting enough blood, which means it's not getting enough oxygen, and it stops beating. Now, cardiac arrest can be due to that, but cardiac arrest can also be due to electrical situations, electrical failures in the heart. Keep in mind that muscles are stimulated to contract by nerves that send impulses into the nerve that cause it to contract. And of course, your heart is contracting on average usually between, when it's normal, between 60 beats in a minute and 100 beats in a minute. And so this is something that's on all the time. And when you have a cardiac arrest, usually in the cases of the young people, it's a problem with the electricity in the heart. It's a problem with the nerves. You can kind of think of it as a shorting outage of the heart. The nerves stop sending impulses for whatever reason, and so the muscle doesn't contract anymore. there are several reasons why this might happen. By the way, it needs to be borne in mind that sometimes young people can have heart attacks. They can have vascular events if the vessel is not where it's supposed to be, if it's what they call an anomalous placement, where the vessel kinks or moves in such a way where it gets suddenly occluded, and those things happen. But most of the time with young people, it's an electrical event because they have an underlying disorder that causes the impulse not to be conducted throughout the heart the way it should. It may be because of a structural defect. It may be because of valvular disease that moves the fibers of the nerves out of the way and causes them to act in such a way where the impulses take too long to go through the heart, to be conducted through the heart. And so you have abnormal rhythms. There are certain environmental things that can cause people to have cardiac arrest. You may recall Len Bias, who was the first round draft pick for the Boston Celtics in the early 80s. I think the same night he was drafted, or maybe the next night after that, he used some cocaine. Cocaine is known to cause cardiac arrhythmias, and he had sudden cardiac standstill where his heart stopped. First of all, it started beating too fast, and went from beating way too fast to not beating at all. In younger people, obviously, who aren't using drugs, you can have situations such as WPW or Wolff-Parkinson-White syndrome, where there is an area that is starting the heartbeat and it interferes with the regular heartbeat, and they cancel each other out and the heart can stop. Things such as if you have underlying problems, they can be exacerbated by dehydration. They can be exacerbated by certain stimulant medications. I mentioned cocaine, but even some of other types of stimulants, whether it's decongestants or Adderall. Some of these medications can make an underlying situation worse. So all of these things can factor into why a young person would have a terrible event like this.
With Len Bias, you just described his situation, which he was 22 years old. In '86, 2 days after he was drafted, he passed. And we had an understanding that the use of cocaine led to this event, but we don't have that understanding with Bronny James. And how does this compare and contrast with a Damar Hamlin who was on the field actually playing, where we assume that it was a hit that he took? Could that have been just caused by, as you were saying, a defect? And like with Bronny James, he was on the court practicing. How do these things happen when you have these cardiac events and you have a rest just in regular motion or regular play or practice? How does that all come about? How does that happen?
You know, it's interesting. I think with Bronny, I don't know all that transpired, but I don't have any reason to think that there was any drugs involved. We just need to have more information, and I'm sure the doctors will be doing the necessary tests, Holter monitoring, where they check his heartbeat over a period of time, echocardiogram. They may, depending on what their findings are, they may even do a cardiac cath to see what the blood vessels in his heart look like. If you ask me to go to Las Vegas and make a bet on what happened, my best bet would be that he has some kind of underlying conductive disorder in his heart that was probably set off at this particular time by chronic dehydration. That's one of the things that I really want to speak to your listeners about, something that they can take action on, whether they're young or whether they're older. When you're chronically dehydrated, as we're seeing in these massive and prolonged heat waves that we're experiencing in America, especially in the American West, which is in Los Angeles, here in Las Vegas, you're seeing people who get their acid-base balance off. They get their electrolyte balance, especially their electrolyte balance, off because they're not properly hydrated. And it creates a situation where they can be easily set up for all kinds of problems, from fainting to rapid heartbeats to irregular heartbeats to atrial fibrillation, all kinds of problems. And I would suspect that Ronnie going to practice, being out in the heat, he probably wasn't staying as hydrated maybe as he should have, and whatever was underlying wrong in the first place was kind of activated in the setting of his dehydration. So I want to encourage people to drink with intention, drink water with intention, and hydrate during these very hot times. And you cannot do that on the basis of your thirst alone. You have to go beyond your thirst and take your water like it's medicine. You take medicine, for example, for your blood pressure. You may not feel that your blood pressure is up, but you take it so that it won't go up. And you should drink the same way. My recommendations for this kind of heat is that people should try to drink at least half of their body weight in ounces. So if you weigh 180 pounds, you would want to drink, or 200 pounds, say, you want to drink 100 ounces of water a day, which is about 1.5 gallons. It's a lot of water. But you would be amazed at how much water you lose in this kind of heat. And that's even if you don't, if you're not working outside. You can get behind pretty quickly, riding in a hot car, waiting for it to cool off, going into the garage that's hot, going outside to walk the dog. Over days, you can get behind and find yourself really feeling badly over a period of time because you were dehydrated. And heat prostration, heat stroke, heat exhaustion, and all other heat-related maladies that take place when people are exposed to too much heat for too long.
That's excellent. I had never thought about dehydration as one of the outliers that cause these type of cardiac arrest. And we tell young people, especially young athletes, drink water. And, we always hear, I don't like water. I don't drink water. I don't know how, I don't want any water. I'll drink a sports drink. So they'll get whatever popular sports drink is around, or they'll get a soda or some type of juice, but they refuse to get the water to hydrate themselves. And simply all they have to do is drink half of their body weight. Is that what we're saying?
Half their body weight in ounces.
Okay, so half of your body weight in ounces.
And I said, yes, and I said water, but it doesn't. It can be seltzer water. It can be water with some of these flavored drops in it. I wouldn't suggest sugary drinks. I wouldn't suggest Kool-Aid or sodas.
Right.
I had a 60-something-year-old patient who came in the other day, and he drinks Kool-Aid, and I was amazed. The last time I had some Kool-Aid was the last time my mother made some when I was going outside to play with my friends in high school. So I was kind of amazed that he was, it's one thing to have a sip because there's nothing else around, but for you to actively just pour sugar down your gullet,
yes,
as a grown man, it's kind of amazing. So you can hydrate, but, that has other problems in terms of hyperglycemia, diabetes, weight gain, all kinds of things. So you want to try to stick with water, and you can mix it up. You can have some milk sometimes, or some almond milk sometimes. People need to be aware that alcohol has water in it, but it's also a diuretic. So if you're drinking beer, if you're quenching your thirst with beer, you're going to end up at a net deficit of hydration because you're going to pee off excessive amount of water. So good Lord made water for a reason. It's hard to believe that people can't stand to drink something that's essential to life, but they're that they're constituted, that 70% of their constitution is this very fluid called water.
Correct.
But it does happen, but you just have to find a way to get that liquid into your system, because you're not going to feel very good if you don't, especially in heat like this.
I understand that. Doc, when we're talking about raising awareness and getting young athletes to understand some of the responsibility that's on them, how do we as community leaders, how do we as parents, how do we raise that awareness and prevent cardiac arrest in our young athletes?
I think there needs to be the first line of defense is with parents and with coaches. They need to understand how serious this whole hydration issue is in heat like this. We haven't seen anything like this before. All of us have experienced excessive heat for a day or two, but you're talking about 3 weeks in Texas of heat over 100 degrees, and you can't ignore that. No one would laugh or call you a wimp because you're drinking water while you're having football practice or soccer practice inside of an easy bake oven or inside of a crock pot where it's hot and humid. So, and that's where we are now. We're exercising and exerting ourselves inside easy bake ovens and crock pots. And you have to create a culture of hydration. You can't be saying that people are wimps or that they're not tough because they're asking for their water. You're gonna have a bad outcome or bad situation where kids are gonna collapse if you have that kind of macho man or macho or superwoman attitude towards our youth. So it starts with them, and once the parents understand this and the coaches understand this, I think the kids will pay attention. There need to be intentional water breaks where everybody drinks water. You just don't stop practicing and you go and just go inside in the air conditioning and talk and putz around. Everybody needs to put some water into their system or some kind of hydration into their system to make sure that they don't get too far behind with their food.
That's an amazing idea. And I know a lot of coaches, we grew up in a time, and there were times when coaches would punish you by taking away hydration when you missed assignments, you didn't do your job. But you're saying do the reverse and make sure that you're extra hydrated while you're going through these breaks. Then should be segmented between each time that you're getting ready to break. It should be a water break. Yeah,
you should be taking regular water breaks and encourage your students or your athletes to get hydrated. Another thing that this whole Bronny James affair has brought up to me and I hope to others is that there needs to be more cardiac defibrillators around. Bronny James would be dead if he was at home, and most of these episodes do not happen on the football field. They happen away, maybe at a park where kids are playing. They're just playing a basketball game or pickup football game, or sometimes they might be at home in the yard mowing the lawn or whatever. And not only among children, but certainly among older adults. I, about 5 years ago, made an investment in a cardiac defibrillator. I have one at home. You can get one for between $750 and $1,500, and obviously that's not cheap. But you have to think about what your life is worth, and certainly if you have a family history of sudden cardiac events, which I have very strong in my family, it's a wise investment. And it's a wise investment not only for you, but for your community, because if your next door neighbor collapses or across the street neighbor collapses, then of course there's a defibrillator in the community or in the neighborhood that people can use, and you're not standing there helpless. These machines are idiot-proof. You don't have to be a doctor to use them. They tell you exactly what to do. You press the button, and it tells you step by step what to do. To place the pads on the heart, where to place them, when to push the button to, or whether or not to push the button to defibrillate or to charge the patient's heart. And they're life-saving devices. They're amazing life-saving devices. They saved a whole lot of lives. And I would encourage our educators to make sure that they have one, if at all possible, to have one in the gym, to have one in the stadium, to have one in the principal's office, maybe all of those places. If the budget doesn't allow that, then they at least have one in the building that's accessible, maybe closer to the athletic side than elsewhere. But it needs to be there, and the responsible parties need to know how to use it. You watch a 15-minute video, and you get a sense of how it's done. And if we broadly do this, we're going to save a lot of lives. And one of them was Bronny James, when they were able to cardio-resuscitate him immediately and keep him alive.
Dr. Fortson, let me ask this. Are there any recommendations for organizations or sports governing bodies that you would leave a message to address this situation and crisis that's happening with our student athletes?
I would refer the leaders of the schools, school administrations, etc., to the American Pediatric Association. They have information regarding this, and or the American Heart Association. Both of those organizations will have information regarding the importance and accessibility of cardiac defibrillators.
You know what? All of this has been such great information. It really gives the listeners something to think about, and community leaders something to really start processing and putting into their plan as we're working with youth athletes and we're in youth athletics. As we conclude, what message would you like to leave with our audience in regarding the crisis of cardiac arrest in youth athletes?
One, do not participate in any competitive or organized sports without getting cleared by your physician to do so, and don't allow your children to do so either. Two, if your children have any complaints about dizziness, feeling weak, chest pain, fluttering in their chest, sudden fatigue, take those complaints seriously. Go to your doctor and make sure that they're evaluated. Three, do whatever you can to get access to or allow access to a cardiac defibrillator where a large number of people congregate or a large number of athletes congregate. 4, stay hydrated. And 5, be sure to maintain and develop and to maintain a culture of hydration wherever you are working or playing.
Wise words indeed. Wise, very wise words, and something I think we should all put together in our plan. I like it, and hopefully our listeners will not only heed your words, but start to take this awareness and take this and start putting it together. And hopefully we can do some things to help our student athletes along the route of going further and extending their careers by using some just simple health tips to help them along the way. So thank you, Dr. Fortson, for joining us today and shedding some light on some critical issues. I think together we can make a difference in bringing awareness that will help save some lives for young people.
Well, I thank you for your time and your attention and your work in getting this important information out to the general public.
You know who this is. You know what it is. It's the Sizzle here on WGVE, the voice of Gary, the voice of education, WGVE, where you're listening to us every Saturday. You know what it is, 8 p.m. to 12 a.m. We are here, and we want you to make sure that you stay tuned and make sure that you follow us on any of your social media platforms. Make sure that you like, subscribe, and share. All you have to do is look up the hashtag, the SIZZLE219.